Welcome back to another episode Talks with AJ podcast. I am your co-host, Poised with Style and Grace 22. And today I have the honor of presenting not one, but two fabulous nurse practitioners. We have Julie Joseph, and we also have Murielle Leon, who will be bringing you important information about breast cancer and awareness. Let's give it up for the two nurse practitioners. Hey, welcome, ladies. Welcome. How are you all feeling today?
Great. Feeling really, really good. Thank you for having us.
Well, thank you all for coming. And we stand in solitude in pink. Thank you,
That's
ladies.
right.
All right, so let's get into it. Well, before I get into it, let me just give a little background about these ladies. Both ladies, again, are both family nurse practitioners and adjunct nursing instructors, local university. They both obtained bachelor's in nursing from Florida A&M University 2018, and they both also too obtained master's degree both at Barry University in 2018. So let's get into it, ladies. What is breast cancer?
Well, once again, thank you so much for that. Just wanted to go ahead before we go into the discussion. Just disclosing that we definitely, our background is in primary care where we work in the clinic and we're seeing the patients that are dealing with these things because of the screenings and the different things that we may have to interpret. So this is one of the, of course, October being the Breast Cancer Awareness Month. We feel so obligated to just go ahead and continue to spread the information. So this is why we're here. We're happy to be here.
Thank you,
And
ladies.
again, breast cancer, I believe, is such a, once we hear the word breast cancer, I think it immediately, for most women, it brings some type of fear. I think in our 20s, we didn't really think much of it. But as we start to progress in age and we start to hear breast cancer, we tend to tense up. So I believe knowledge is the best information we could give to one another so that we could push forward and prevent and catch things early. So what is breast cancer? Breast cancer is defined according to the American Heart Association as a tissue that is continuously growing in an abnormal rate in the breast area. So different parts of our bodies have a specific cell. So there's the breast cells is confined to the breast area, but for some reason, this area tends to have a cell tissue that starts to multiply in an amount, a rate that is abnormal, and it tends to make what they call a lump because it's multiplying in such a fast rate. So this is what they defined it. I could read another definition. The process goes wrong. Cells starts to multiply without control. These abnormal cells can form a lump or mass that can often be felt or seen in imaging or in self-testing.
Okay. So, who does breast cancer rather affect the most?
Yes, we will definitely go in there. So there is different types of breast cancer. So there's the breast cancer in general, but there's different parts of the breast that the breast cancer affects. So I'll just list the four different ones. And again, they'll go into more details when they define them, when they do, if they're diagnosed. So there's the ductile carcinomas, there's the lobular carcinomas, there's the invasive breast cancer, and there's non-invasive breast cancer. All of these makes a difference in the approach of treatment and even how aggressive the cancer tend to be. Who does breast cancer affect? Of course, it affects mainly women, but men can get it too.
Interesting.
It is not only a woman's disease. It is estimated 310,720 new cases of breast cancer is diagnosed every single year.
That's a lot.
Wow.
It's a lot.
Yes, very astounding.
And
Number.
about 56,000 of that is the more aggressive form. So it's still very, very high number considering that we are a very advanced medicine-wise. We're very advanced, right? And modern medicine. Even though there's a lot of diagnosis, but the aggressive form is still pretty high. And in the United States, the ethnic group that is affected the most, has the highest mortality rate, is the Black ethnic group. So who gets breast cancer the most? Actually, white non-Hispanic women. Non-Hispanic women is diagnosed more with cancer, but the people who die the most from it
Or African.
is African Americans.
Wow. That's very interesting to learn that we.
Yes.
Why do you know why that may be? Why is it that in the black well, African Americans die at a larger number mortality?
So I'm glad you asked that question. So one of the key reasons why the African American community is dying at an alarming rate is because of lack of screening. Growing up, especially in my culture, that's not something that is taught or done in the community. So I'm from the Caribbean. Well, my background is from the Caribbean, and that's not something that our parents was educated on to do. So it's mostly screening. They're not going in to do their yearly checkups with their providers, or they're usually waiting to the last minute when something is already felt or have grown to go in and seek some type of help. They're not, staying up with guidelines like at the age of 40, you should be getting your mammograms. They're not doing any of that. So that is one of the real problems here. This
So
is
lack
what's
of
happening.
education,
A lack of
primarily-
education, primary education, or it could be a cultural thing, a belief, type of things. Like it's a lot of things that play into that.
A lot of barriers.
A lot of barriers that kind of limits the amount of us showing up
Got it.
for ourselves or taking better care of ourselves.
In the Haitian community,
Yeah.
how do you see that? Like, we're Haitians. How do you see that with our folks?
So, based on statistics, a lot of what they base mortality rate is based on 100,000. So for every 100,000, they'll do like how many within that 100,000 is affected. So we are just Black women dying from cancer is 26.8%, which is it's a high number.
It is.
And I'll go back and break down the statistics between Broward and Dade County and for new cases. I believe especially for the Haitian community, knowledge deficiency has been pretty much number one. The knowledge, the barrier, I believe if there's somebody who does want to get to know more about their health, sometimes providers are not engaging because they may assume that the person may not know. And I could tell you, I've been with my mom to the doctor visits. They don't know I'm a nurse practitioner. I don't say anything. And the approach is different than when I start to say I'm a nurse practitioner.
That's true.
The whole language changes. The way they speak to her, the way they handle her changes. So when they're going out there on their own, they automatically, sadly, there is a stereotype. Automatically, it's like, okay, she may not know English, or she
Language
know a
barrier.
little, or let me just, hey, did you go here? Did you go there? But there's not the education of
or
why.
the push.
Yes.
Or the push of, you need to go because this is what we're looking for. I believe if we're explaining better and more, it would give a little bit more motivation to understanding the whys.
Got it.
And another thing I believe is our culture, we try to self-fix a lot of things.
Yes.
We may feel a lump.
And we're going to take a tea to
Yes.
drink this
We
away.
may
Everything.
see something and we like, go get the tea.
Yeah.
Go back in the backyard and
Yeah.
they tell their sister, they tell
God,
their
poor thing.
friends, but they don't never go to the doctor.
Right.
Or they convince them not to go.
Go, like, it's
This is
okay.
true.
This is nothing. And it prolongs something that may be critical. So I see that. And lastly, I do believe financial barriers.
I was going to ask that as well.
Yeah. So as you know, a lot of people are relying on, insurance to get basic care. So now, if you don't have insurance, these become a roadblock because doctors do not. You can't just show up to an MRI place and say, okay, I want a mammogram, and you don't have insurance. And without insurance, these things are expensive.
Yes, they are.
So these are some of the barriers and what we call disparities that may be contributing to the high mortality rate of the black women.
Okay. What are the si- well, what are the signs and symptoms of breast cancer?
All right. Well, I just want to start with the risk factors first.
Okay.
Okay.
Go ahead.
Because, I mean, yes, women get breast cancer and so do men. All right. So it's about like 1% of men will be diagnosed with breast cancer. So as far as risk factors, these are non-modifiable. So it doesn't matter your age, you being a woman, genes, your genetic. I'm not sure if everyone's aware of BRCA1 and BRCA2. This is gene makeup, and if you can get that, you can get tested for that. And if you test positive for it, positive for that gene, there's a likelihood of you developing breast cancer. A famous person that did that test is Angelina Jolie. And her mom had breast cancer. She tested positive, and she decided to have a prophylactic mastectomy where we remove, well, not we, but she had both of her breasts removed and replaced with implants because she already carried the gene for it. So she didn't want to go through what her mother went through. Okay. Right. Modifiable risk factors are your weight, sedentary lifestyle, you don't work out, you're a drinker,
Diet.
You eat poor food, like you eat a lot of processed foods. You had your, well, that's not non-modifier. That's a non-modifier. Is you had your period before you were 12, or you went through menopause after 55. You didn't have kids. You had your first kids after 30. So these are things that, can put you at a greater risk of developing cancer. If you have a family history, like your mom, your sister, or you have a daughter who had breast cancer, that also increases your risk of having breast cancer as well. Yeah. As far as the signs and symptoms, we're doing this because we want everyone to be aware. Like the earlier you find it, the more treatable it is, right? Although it can come back, but if you find it really early, the likelihood of it returning is very slim. So, getting to know your body, getting to know what it feels like now, that way if something were to arise later, you can be like, I didn't have this before, or it didn't look like this before. So let me go see a doctor instead of waiting for your yearly checkup. And I always tell my patients that in the clinic, like, why wait a year when you're going to see me again to bring up a concern? Like, get to know your body now, because if you find something, you don't have to wait a year. You can make an appointment within a week and have it looked at and addressed. So, some of the symptoms that I always tell my patient is to make sure that you're looking at both of your breasts, especially in the mirror. You just have your shoulders, your arms and your shoulders spread apart, and you're looking at both sides, making sure they don't have to be twins, but they're sisters. Making sure the color is the same. Your nipples are not inverted, so your nipples are not turned inside. I tell them to squeeze both nipples, make sure there's no fluid, discharge, milk. If you're not breastfeeding, coming out. Make sure there's no mass or lump or asymmetry of the breast, so the breasts look like one side might look dimpled and the other one doesn't. Like, get to know how your body looks. I always tell them feel, touch, get to know how the tissue feels now. For our women who still have their period, you want to wait like 7 days after your period, because every time you have your period, breasts are very tender. So you wait after you have your period. Feel your body, touch your breasts. Make sure you don't feel any movable lumps or any pain when you're feeling your body. Once you know how your body feels, as soon as you find something, you're going to be like, oh, wait, this is not right. It didn't feel like this before.
Right.
Let me go get it checked out,
Okay.
And I wanted to just piggyback, just to add to
To
what Murielle is saying. She went to say for girls who had a menses early, and for women who have went to postpartum
Menopause.
menopause in their 50s. So what does that mean? It means that estrogen is introduced very early or for a prolonged time, which increases the risk of the breast cancer. Because what breast cancer is, it's attracted to that hormone. That's what gives it life. So just for you to understand what's going on with that. And again, just getting familiar with your body. I know that we kind of say, I'm not my mother, I'm not my granny, I'm not this, but generation, bloodline doesn't lie. It will show consistency with outcomes. So the more first, what we call first generation family member that has it, then the likelihood of you having it increases. So if mom had it, grandma had it, you're very high risk for having it. And then again, it's not to impose fear,
right,
but I believe our health is our wealth,
right,
and if you're not in a place where you're healthy, it affects everything eventually in your
right,
It's
life.
a trickle
It's a
down.
trickle effect.
Yeah,
right.
it's a trickle
Absolutely.
effect.
So, the first generation, again, just who knows your body better than you?
Agree.
You do. So any abnormal thing, I go to my doctor, and like Muriel says, she said, before your exactly that little window before your period, your they call it the breast tissue tend to thicken. So it may scare a lot of women. They're like, oh my God, it feels so full and it feels so tender. So we would say wait till about a week after
After.
your cycle just to make sure. And if you still see that same thing there, it feels uncomfortable, all just go and get it looked at, get it checked out.
I also wanted to add something because there's a huge misconception that if I take birth control, I'm going to get cancer. A lot of women avoid starting contraceptive because of that misconception, and I just want to say that's not necessarily true. What is true is if you already have cancer cells in your body and you start any hormone treatments that includes estrogen or progesterone, it just accelerates it. It feeds the cancer in your body. So if you're getting your yearly checkup, your mammogram, colonoscopy, your PAPs, and everything is fine, then it's okay to take contraceptives. But if you have any cancer cell in your body and you start taking hormones, especially with our older patients that go through menopause and they start getting on hormone replacement to help with hot flashing and vaginal dryness and libido and all that good stuff. But they don't keep up with their screenings, and then they have a bit of cancer cells in their body, and as soon as they start taking these treatment, they
It
got cancer.
accelerates
It
it.
like you fed it, you gave it what it needed to grow, so it accelerates in the body, and then guess what? We got to stop the hormone treatment, and then now we got to do biopsies and make sure what kind of cancer it is. Is it benign? Is it something that we got to worry about?
Okay.
Yeah.
What screenings are out there for breast cancer?
So we do have different types of screening. The first screening, of course, is we recommend for women ages 40 and up that they get at least every year. Some guidelines say every other year if there was no abnormality, for what we call a mammogram. It's a basic imaging where it goes and look at the breast tissue for any abnormality. Again, she mentioned breast self-examination is usually the first screening that we recommend for all ages. It's not just for a woman to check every time. If they take a bath, again, put your hand just while you cleaning that area, just check anything abnormal. That's the first screening. The second screening, of course, mammogram. If a person is high risk, let's say again we're dealing with that first generation, mother had it, grandmother had it, auntie died from it or had it, now you're at risk. You tell the doctor, they will start mammogram screening as early as what age you see?
30.
30, right?
Yeah, so
Usually
that's 30.
30s. Yeah. And for some reason there's a tendency, the younger the person is diagnosed with breast cancer, it tends to be more aggressive. It tend to be more aggressive, the younger, which we don't know why the genes tend to be more aggressive, the brackers.
And it's sad, but in the line, because I do women's health now, so I don't do primary. So I primarily see women, right? Um, and when I get these girls that come in with their concerns and we send them off, just to do a screening mammogram. And mind you, mammograms are very important. They can be painful, but it's very important because research says if you get your mammogram, it can detect a cancer 2 years before it starts to grow. Okay, so that's very important. But it saddens me when I send these young girls in their 30s and it comes back like, oh, they find something, and then they have to do biopsies. So it's just very sad when you get that back and then you have to talk to someone in their 30s who haven't even had children yet, and they're dealing with
That unknown.
this big stigma, the word cancer, the C
Cancer,
word,
yes.
But I would say that I don't want to say most, but the survival rate is higher because they're healthier than someone who's older or lived a very sedentary lifestyle. But I just want to spread the message that it's very important that you keep up with these screenings. It's very, very important. I know some people want to avoid the x-ray and, they want to do the holistic thing. But it's just important. I always tell my patients that are like, kind of want to avoid all the Western medicine thing, just do one.
Right.
Just do one, just see where you at, just one time. Because that one time could save your life,
Yes.
And I know that some people, when they're diagnosed, immediately, of course, if there's an abnormality, right? Because I had a little scare where I had an abnormal ultrasound.
Okay.
And they're like, automatically, there was a little window for me to get the mammogram. So I'm just like,
What is this?
What is this? What's going on? I'm nervous. It's very nerve-wracking, okay? But within this window, this is the time where I did get as much knowledge as I could possibly can, right? Just so I could know, okay, what does that statistics look like, or what is expected of me? And I know, and like they said, does it hurt? Because now they wanted to do what they call a more diagnostic test. And that is when they go and do more pressing. Is it uncomfortable? Yes, it's uncomfortable.
Very.
I'm not going to sit here and say it's not, but it's temporary discomfort. It's not unbearable, right? And the next step, if it is positive, this is where it becomes, a little bit more detail. Yes, the only way to fully diagnose breast cancer is through what we call a biopsy. So they will have to take a sample of that tissue to go and test it to see what cell is showing up. And yes, does that hurt? It may hurt for some, right? But this is the definitive diagnosis. So the mammogram, it helps to catch certain things, to see what is that abnormality. If they highly suspect it, then they're going to go ahead and recommend a biopsy.
Okay, so that would be like the other general screening
This,
that would be recommended.
Well, the biopsy is diagnostic.
Diagnostic.
So it's going to
It's
tell
diagnostic.
us
Okay.
if you have it,
Yeah.
Right.
what stages it's at, and all that stuff.
Okay. Got it. So is there any other general screenings that would be recommended for women's health?
Well, just a mammogram, self-breast examinations. If you have a family history or you're at high risk, then you would start mammograms at 30. If not, you wait till 40 unless you find something.
You did mention something earlier about pap smear. Would that
Yes.
also?
Yes.
Well, PAP
Okay.
PAP is another screening. We
Screening,
screen
right.
for cervical
Screening.
cancer.
Okay, got it.
right?
It's all
That's
in
another
cancer.
screening.
Okay.
Yeah, it's all in the
Okay.
family
Kept
though.
cancer, but
It's all in the family.
All in that.
Yeah.
Right.
So PAPs are done every year to every 3 years if you have abnormal. So then we're
Got
going to talk about HPV,
Yeah.
the virus that can lead to
Right,
cervical
right.
cancer.
Okay.
But since this is breast
Breast
cancer
cancer,
month,
we'll stick to
with
the
breast
mammograms. Got it.
We can
Got
pick
it.
that up if you like next
Yeah.
time.
Next time. Got it.
Because
Got
that
it.
one is on. It has its own battles too.
Got it.
Yeah.
Got it.
But yeah, breast cancer is very serious. I have someone personal to me that went through it, went through chemo, radiation. So it's a lot. It's very trying
Very
on the
much.
person themselves and also family as well. You know.
It's a whole system.
Yeah.
It affects the whole system as much as and this is why we're taking a holistic approach. We want to go ahead and focus more on what we call health promotion and prevention. Prevention would be us doing screening. This is what would be considered. And promotion is let's go ahead and remain healthy. Let's eat well. Let's exercise. Let's stay away from the smoking, the hookahs, because a lot of it they don't really know the effects it have fully on the body, because this is still kind of like more. It's starting to become more common in society now, right? But when we were growing up, hookah was not as popular. So all of these different things are playing a factor in contributing to different things in the health arena. So what they're saying is just as a woman, let's just try, because women, believe it or not, we're even having children later in life.
Oh yeah.
Yes.
So women which shows us that women are healthier
Yes.
compared to our previous generation of women who were very industrialized, right? Because the men were in war and they were working laborious. So this is why you had they recommended not to have children after a certain age, because it showed they had a different outcome. But with us, we're healthier, we're young, we're looking younger, and so we have a better opportunity, I believe, compared to the previous women's. And I think we should take all of that into consideration, take care of ourselves as much as we can, and continue to spread the word, not only to us but to the women in our family. Hold our mothers accountable.
Yes.
Because some of them, you'll be like, did you go do this? Did you go to the doctor? No. If you have to take a day off of work to take them to the doctor,
I would say
go.
it's mostly they're afraid.
Yes.
Yeah.
They're
Yes.
afraid.
Of
They
the
don't want.
unknown.
Yeah,
Yes.
they don't want to know.
They don't
They
wanna
want to
know.
know.
They don't. They don't.
And I never understood it. I guess because we're in the medical field, we're
The
just
crazy
like,
part is
tell
like,
us?
yeah, like no. For us, I think our generation we're more open. We want to
Yes.
know.
We wanna
like,
know
Tell
stuff.
me, tell me.
Yes.
You know, for them, they're like, don't
No.
tell me. I'd
I'd
rather die with
in
it.
peace,
I
not
die
knowing.
in peace and not knowing.
Yeah.
I mean, I gotta respect it, but I don't understand it.
Yeah.
Because my mom is that. She's like hard headed, and she works in the health field.
Yeah.
And I gotta tell her like, Mom, are you gonna do this? Yeah. I'm gonna do it when I'm on vacation. She's on vacation. Mom, no, I gotta clean the house. I gotta do this. I'm like, okay, all right.
I mean, there is a saying that those that are in the medical field,
Oh,
they're
we're the
hardest,
worst patients. We are.
the worst patients to have.
patients.
Yeah.
We are.
So, in closing, ladies, what would you guys say to like the family members or the spouse who has, a wife or, a family member, mother, sister that is going through breast cancer? How can they be encouraging to that individual?
So for me, what I spread with any interaction I have with my female patient is you have to advocate for yourself. You have to be your own advocate. Like, you cannot let somebody dictate what's going to happen with yourself. Yes, we all have busy lives. We're moms. We wear many hats. But if we don't take care of ourselves, we can't be present. We can't not do all the things that we do now. So we have to prioritize our health. We have to put ourselves first at some point, and take care of ourselves, because if we're not there, we're going to be replaced. Right?
Yes.
We're going to be replaced.
Yes.
Right? So we got to show up. We are the matriarch of the family.
Yes.
We have to show up for ourselves. We got to take care of ourselves. We have to advocate for ourselves. Not everyone has a family member in healthcare, but Google, ChatGPT now, like you pretty much can self-direct your health at this point. You can educate yourself because I have patients that tell me, no, I want this, that. I'm like, okay, ma'am, no problem. But if I don't agree with it, I tell them, I don't think that's the right route. But I feel like our generation, we're very educated, we're very intelligent. We know. So as far as us helping our parents, because I see like now the roles are reversing and our parents are the kids.
Yes.
Um,
Yes.
and it's like you got to tell them like, hey, we got to we got to do this, or schedule their appointments. I just feel like we have to be more on them now, like make sure that they're healthy overall, like we're checking up on them, making sure they're
intentional.
being
Yes.
intentional and committing, being committed.
Definitely. Just to add to what was already being said, one thing I know is that sometimes one of the barriers that one may say they have gone into is, yes, they found something irregular and the insurance doesn't want to cover for further, because we have that too. There's of course the politics of that, but I would say continue to push for your health somewhere. Just keep pushing. Eventually, with the right wording, the medical person, if we know how to write and play with words, they eventually will do the test. The other part of it that we don't like, because if you don't fit that box, this age, this symptom, this way, we're not gonna do this.
That's true.
And that's another thing, because I see it in the forefront where the person say, I went to the doctor, I told them this. Then a year later, the same problem becomes a bigger problem because they would not do the test. So I would say continue, even ask your doctor, can you reword it a different way? And they're gonna be like, what you mean? Say, I was told that we could, how we could play with words, and we do. We have to, so that we advocate for the patient. So just like the patient advocate for themselves, a good provider also will help to advocate for the patient as well. And family, even men, I would say are affected too, in a sense of when their wife or lover or mother, sister, or grandmother, when they're diagnosed with this breast cancer, it's like the next is the unknown. And I believe to watch their family go through the different phases of treatment and how it changes them, and how even their everyday activities of day living is altered. It affects the spouse too, and in different way. They may not know how to support their the women in their life. So I believe they also need support too. Don't be afraid to seek help. Or there's different groups. They're all over, breast cancer, survivors, spouses of breast cancer survivors, so, or actively going through it. So again, resource is out there. It's just you asking, or searching.
Got it. Is there any resource that you guys would recommend before?
So for mammograms, there's a Florida Mobile Mammography. Yeah. They do free mammograms, or if you have insurance, they take insurance as well. Med One does free mammograms and PAP if you're over 45. If you have insurance, you pretty much can go anywhere. You can go to your primary provider or your women's health provider, and they can give you the script for ultrasounds. If you're less than the 40 years old mark, you'll start off with a breast ultrasound or an MRI, and then if they feel or they deem that you need to have a mammogram, they'll refer you and recommend that, and then you can get the order that way. But there is a lot of resources out there. You just have to Google search free, and these things will come up.
Here's a number if anyone wants to take down. This is for the Florida Breast Cancer Foundation. This foundation will link you based on your where your demographic is. What is the nearest place that you could go for free mammogram or get the resources you need? The area code is 305-631-2134. 305-631-2134.
Okay. All right, thank you, ladies, so much. It's truly an honor, a pleasure to have you all today, bringing so much information and also providing resources where the women can go ahead and get checked. Is where can everyone find you all?
All right. So if you want to visit me at my office, I work for Venetian Health, OBGYN in Hallandale, Florida. My handle on social media is MS Leon on Facebook, or you can find me on IG on AxNP Leon.
Okay.
And I work in Covenant House, Florida. I specialize mainly in young adults that is dealing with primary care, so ages 18 to 22. However, I'm not limited to that. Um, if you need a resource, guidance, you can always reach me. We're very open. We do different things in the community. My IG is JULFANFAN1. That's how you find me, Jewel Fan1. Thank you.
Thank you, ladies, again.
Thank you.
You guys, this was another great episode for the books. Please don't forget to like, comment, and subscribe to our channel at Talks with AJ Podcast. You can find us on all social media platforms, YouTube, Instagram, TikTok. We're on it all. Again, thank you all for your support.